Hello everyone, my name is Catherine Sofel. I am a registered dietitian nutritionist, and today I will be going over the BRAT diet. So today's objectives, we are going to go over the background information and explain what the BRAT diet is. Review the target population, so which individuals would be on the BRAT diet or utilizing the BRAT diet. The foods to consume on this diet, foods to avoid, and then we're going to go over some questions and answers. So the BRAT diet stands for, it's an acronym, so it has 4 different foods: bananas, rice, apples, and toast. So this seems like a very plain and bland diet. And it's specifically used for nausea, vomiting, and diarrhea. And it focuses on specific fluids, so which fluids are going to be best for individuals who are having nausea, vomiting, or diarrhea. It will review bland foods that are nice and gentle on the stomach and won't cause additional irritation. So there are some causes specifically that will induce nausea and vomiting, or that can. And the first 3 are going to be the main ones. So the norovirus, viral gastroenteritis, which is known as the stomach flu, so I'm sure many of you are familiar with this. GERD, which we will review briefly, and then some other causes of nausea and vomiting. These can be acute due to medications, severe pain, gastroparesis, intestinal obstructions, anaphylaxis, appendicitis, cholecystitis. COVID-19 patients may also have nausea and vomiting. Diabetic ketoacidosis, ear infections, fever, motion sickness, migraines, hiatal hernias, alcohol use, or heart attacks. So we will focus on the top 3 main ones. So norovirus is an enteric virus, and it is the most common cause of gastroenteritis in in adults and elderly. So this is a fairly common acute illness that you may see in long-term care or assisted living facilities. It is highly contagious through the spread of vomit, food, water, or infected surfaces, so it can easily spread from patient to patient, especially throughout care facilities. And long-term care facilities are actually the most common setting for norovirus outbreaks. And the symptoms of norovirus include nausea, vomiting, diarrhea, and stomach pain. And the symptoms of norovirus can last anywhere from 1 to 10 days. Next, we have viral gastroenteritis, which is also known as the stomach flu. And this is an intestinal infection, so it is an infection within the intestines of an individual. And it is spread through contact with an infected person or contaminated food and water. So again, if an individual is sick, it can easily be spread from one person to another. It can actually be deadly to elderly or compromised immune systems. Again, just because of the nature of the illness, it can easily cause dehydration. And the symptoms of viral gastroenteritis include diarrhea, abdominal cramps, nausea, vomiting, muscle aches, headaches, and fever. And again, the symptoms of the stomach flu can last anywhere from 1 to 10 days. GERD is gastroesophageal reflux disease, also known as acid reflux, and this is a fairly common condition in a lot of individuals, actually, especially as we age, and it is the regurgitation of food or liquids. So if you look on the diagram here on the right hand side, this is your stomach and this is the esophagus. So there is what's called a sphincter that separates the esophagus from the stomach. So in a healthy individual, this sphincter is closed, so this is basically a gate or an opening, and it is closed. However, in someone who has reflux, this sphincter or the gate can be opened, and so we have, stomach acid and a lot of other things, secretions in the stomach, and so sometimes those secretions and the acid from the stomach can start to reflux back up into the esophagus, and this can be a cause of nausea, vomiting. Individuals may also experience some difficulty swallowing. So there are some foods that actually make this condition worse. And so in order to alleviate that, we would want to focus on the elimination of those foods that can cause nausea, vomiting, or GERD, and focus on foods to consume that are going to be a little bit easier. Really, the idea here is to make sure that we are consuming foods that do not cause a lot of additional acid within the stomach that can cause the sphincter to open up. And then another technique is, if someone does have GERD, that when they do consume food, they don't lie down for, at least 30 minutes after they eat. So you don't want to eat food and then lay down immediately. Lying down flat on the back can actually cause, some of the food and the acid from the stomach to then go into the esophagus, or start to, reflux back up into the esophagus. So any individuals who do have nausea, vomiting, or any other type of symptoms from GERD, it's important to have them sitting straight up for at least 30 minutes after eating to help reduce the cause of reflux. And then there are medications that can induce nausea and vomiting as well. So antibiotics are a common cause. Antidepressant medications, aspirin, ibuprofen, especially taking these on an empty stomach. Chemotherapy is going to be a common cause of nausea and vomiting. And then opioid medicines or pain medicine. So again, specifically taking these medications on an empty stomach, so the antibiotics, the antidepressants, aspirin, ibuprofen, and then opioid medicines can induce nausea and vomiting, especially when taken on an empty stomach. So especially first thing in the morning, if individuals are taking any of these medications, it's important to have them consume something along with these medications, specifically something that is going to be easy on the stomach, so a banana, a piece of toast, really going back to that BRAT diet of those foods, rice, applesauce, things that are going to be, again, easily digestible but kind of buffering the stomach, and so avoid taking medications on an empty stomach. So the BRAT diet, it was previously recommended for nausea, vomiting, and diarrhea. However, it can be very restricted, and so we've kind of shifted away from the BRAT diet specifically, in not just restricting to these 4 food groups or these 4 foods, the bananas, rice, applesauce, and toast, and instead we've shifted away from broadening the consumption of different foods that are going to be bland and easier on the stomach, along with, the foods that are included in the BRAT diet. And so it really just focuses on foods that are tolerated and foods to avoid. Now, although the foods from the BRAT diet, the bananas, rice, applesauce, and toast are obviously included in the recommendations for nausea and vomiting, there are also some additional foods that we would want an individual to try to consume as well, to just increase the variety. So we will get into those foods and liquids now. So the fluids to focus on are going to be ice chips or water, Gatorade or electrolyte drinks, diluted fruit juice, broth, popsicles, and gelatin. So the reason why I pointed out diluted fruit juice is when consuming just regular fruit juice on an empty stomach, the amount of sugar in fruit can actually cause worsening gastrointestinal problems. So it can actually cause worsening diarrhea and worsening vomiting. So if an individual is having any of these symptoms, nausea, vomiting, diarrhea, diluting the fruit juice can be a little bit easier tolerated, since it's not as high of a sugar content. And then the fluids to avoid are going to be extremely hot beverages. So this can, additionally irritate the lining of the stomach. Coffee and caffeine will also want to be restricted. And this is a couple of reasons. Coffee is an acidic drink, and so when you are consuming that, that can further irritate the stomach and cause worsening nausea and vomiting. Same thing with caffeine. Caffeine can also worsen nausea and vomiting. And then wanting to avoid, again, those sugar and sweet food or sweet drinks that can worsen nausea and vomiting and diarrhea. So staying away from sodas or those just regular juices and trying to dilute the juices. Next, the foods to focus on consuming during nausea, vomiting, and diarrhea are going to be, first we're going to go into the fruits. So soft fruits, easy on the stomach, bananas, applesauce, avocados, canned fruit in water, and then melons. We want to stay away from more fibrous fruits, such as berries. Again, those are going to be a little bit harder to digest, and so really focusing on nice, soft fruits that are easily digestible. So here you've got the bananas, applesauce, avocado, peaches, and then melons. Next, steamed or boiled vegetables. Again, nice and easy vegetables on the stomach. We've got steamed carrots, steamed green beans, squash or zucchini, mashed potatoes or mashed sweet potatoes. So again, nice, easy foods. These all have a little bit lower fiber compared to some of the other vegetables. So again, nice and easy on the stomach, bland food items. And typically we'd want to avoid a lot of seasoning as well. So avoiding pepper or any other type of chili powder, herbs like that can also increase the irritation in the stomach. So really just wanting to do plain foods as best as possible. And then for our starches that are easily consumed, so white bread, white rice, saltine crackers, cream of wheat, oatmeal, and then plain noodles. So as you can see, foods that are going to have a little bit lower fiber. So instead of doing brown rice or brown bread, which would be normally recommended for heart health purposes, the outer fiber layer can cause some additional irritation in the stomach during these acute phases of nausea and vomiting. And so again, focusing on more bland, easily digestible foods such as bread and rice, and even toast here would be fine, uncooked bread or toast. And then saltine crackers are going to be a nice, easy food on the stomach. They do have some salt on them, which can actually help a little bit of salt to alleviate some symptoms. And then cream of wheat and oatmeal, again, a nice, warm, bland food on the stomach. And then plain noodles, which again, nice and easy to digest. Next, for our protein foods that we'd want to consume, it's going to be unseasoned, skinless baked chicken or turkey. So again, avoiding any skin that is going to be on the chicken that's going to be higher in fat, more difficult to digest, and then unseasoned. So we don't want to get pepper or any other type of spices that can cause additional irritation in the stomach. Scrambled eggs or any types of eggs in general are going to be nice and easy to digest. Yogurt, and then kefir. And kefir is a type of dairy, same thing with yogurt, but it's got prebiotics or probiotics in it, and so it's a little bit better than the stomach than just regular milk. So moving on to foods to avoid. Milk and dairy products, except for the yogurt and the kefir that I mentioned previously. We want to avoid fried, fatty, greasy, and spicy foods. These are just going to irritate the stomach even more so. They can also worsen diarrhea. And so we're wanting to stay away from, fried chicken, French fries, donuts, pizza, burgers, any type of greasy foods that can just increase nausea, vomiting, and diarrhea. And then wanting to stay away from pork, because pork is going to be a bit higher in fat compared to your chicken or your turkey breast. So bacon and sausage, again, pretty high in fat and very difficult to digest, and probably not very nice to consume, when we are having some nausea and vomiting. And then avoiding very high sugar foods, so cake, foods like that, again, that high sugar content can actually cause worsening nausea, vomiting, and diarrhea. So really just avoiding these food items until the acute illness has subsided. And then additional foods to avoid, some of your fruits and vegetables, ones that are going to be, again, more difficult to digest in the stomach. It takes longer to break down these food items in the stomach, and so they're kind of sitting in the stomach for a little bit longer, which can, induce additional nausea and vomiting. So raw vegetables such as cauliflower and broccoli, as we see here on this left-hand side picture. Onions, cabbage, corn on the cob. So again, higher fiber foods we'd want to avoid for now. Citrus fruits, pineapples, oranges, grapefruits, lemons, and limes. And the exclusion of citrus fruits is, again, because of the acid content in these food items. So we don't want to add additional acid to the stomach, which can just, cause worsening nausea or vomiting. So just avoiding these foods for now. And then some other items, tomatoes, cherries, grapes, figs, and raisins. So tomatoes are going to be, again, a little bit higher in acid. Same thing with the fruits here. And so we want to avoid those for now. And then cherries and grapes, figs and raisins, a little bit more difficult to digest than some of your other fruits, such as bananas and applesauce. So a sample diet for an individual who is having nausea and vomiting or diarrhea. During the first 6 hours, we want to really give the stomach a rest. So if an individual is actively having nausea and vomiting, really just giving the stomach a rest and not really giving much fluids, other than maybe some water and ice chips. Because when we consume some drinks or food, it can actually cause worsening nausea and vomiting. So you want to just give the stomach a little bit of time just to kind of settle and not make things worse. After 2 hours, so if an individual has gone 2 hours without any vomiting, then it's okay to start including some ice chips and water. So, a couple ice chips at a time, small sips of water. We don't want an individual drinking a whole lot of water or chugging water, so just a few sips of water occasionally, just to see how the stomach tolerates those foods or tolerates those liquids. But we do want to wait about 2 hours without having any vomiting before introducing ice chips or water. And then 24 hours after there has been no vomiting, gradually add clear liquids if the vomiting has ceased. And those clear liquids are going to be the ones that I had reviewed earlier. So the broth, popsicles, electrolyte drinks, or Gatorade, diluted fruit juice. So we would want to introduce about 1 to 2 sips of these drinks about every 10 minutes. So again, we don't want an individual drinking a whole lot or chugging these drinks, just a couple of sips every 10 minutes just to let the stomach see how it tolerates any liquids going in. So again, water, diluted apple juice, Gatorade, electrolyte drinks, weak tea, jello, or broth. And then if vomiting occurs after consuming clear liquids, we'd want to then restart the process over again. So give the stomach a break, about 2 hours, wait 2 hours until vomiting has subsided, and then slowly introduce some of these fluids again and see how an individual tolerates them. So nothing by mouth for 1 to 2 hours, and then reintroduce some clear liquids in about 1 to 2 hours. On day number 2, after 24 hours after vomiting has resolved, then we can start introducing some foods. So adding in bland, low-fat foods, such as the foods from the BRAT diet, so the bananas, rice, applesauce, toast, crackers, oatmeal, yogurt, cooked carrots, eggs, chicken breast, any of the bland food items that I went over previously. These are good foods to start including or adding in 24 hours after vomiting has resolved. And really, the idea is to focus on small meals every few hours. So instead of having 3 standard meals, a couple bites every few hours, again, to let the stomach, have a smaller amount, easier to digest. We don't want to load the stomach up with a large volume of food that can make digesting more difficult. So a couple of bites every few hours, and see how an individual tolerates it. On day number 3, typically day number 3 is when the nausea and vomiting has subsided, but this day, these time schedules may be different depending on the person. It depends on how long their symptoms have lasted. However, typically after 3 days of no nausea or no vomiting, then it's okay to start to progress to regular foods if symptoms have improved for 3 days. And so we still want to continue with small, frequent meals, especially when adding in some of these higher fat foods, because the high fat content of these foods can still cause some irritation. We don't want to, again, overload the stomach with too much fat at one time, so just doing small, frequent meals every few hours, again, to see how an individual tolerates food consumption. And then if symptoms return, so anytime when adding in food, if symptoms of nausea, vomiting, or diarrhea return, we'd want to backtrack and go back to bland food items. So take this down a notch, go back to easily digestible foods, such as, again, the BRAT diet, the bananas, rice, applesauce, toast, oatmeal, chicken breast, foods that are going to be more easily digestible, and then see how things go over the next 24 hours, and then try to re-include some of the regular food items after that. So additional recommendations for nausea, vomiting, and diarrhea. Choose liquids that contain some sugar and salt to prevent dehydration. So again, that's why electrolyte drinks or Gatorade are a great choice for someone who is having a lot of nausea or a lot of vomiting and diarrhea, because the sugar and salt can help to prevent some dehydration and help to incorporate and retain some fluid within the body. We don't want to do, again, a juice that is not diluted, because too much sugar can cause additional diarrhea or vomiting. And then just focus on rest and avoiding exertion. So walking around too much, we don't want to add any additional exertion that can, cause worsening symptoms. And if an individual is having vomiting and diarrhea for longer than 24 hours, especially if it's continually, consulting a healthcare provider is going to be important, because there could be some additional underlying conditions as opposed to just a stomach flu virus. So there may be a little bit additional problems that are happening if an individual is experiencing vomiting and diarrhea that has been lasting for more than 24 hours. Now we are going to get into the questions, and we have 5 questions that we're going to go over. So question 1, what does the BRAT diet stand for? A, bread, rice, applesauce, tomatoes, bananas, rice, avocado, toast, bananas, rice, applesauce, toast, or bread, raisins, applesauce, toast. And the answer is C, bananas, rice, applesauce, and toast. This is the acronym for the BRAT diet. Question number 2, what is the BRAT diet used for? Nausea, vomiting, diarrhea, or D, all of the above? And the answer is D, all of the above. So again, the BRAT diet is going to be used for any nausea, vomiting, or diarrhea, focusing on low fat, bland foods for easy digestion. Question number 3, what fluids should be provided during illness? So during acute nausea, vomiting, and diarrhea. A, soda. B, Gatorade or electrolyte fluids. C, coffee. Or D, milkshake. The answer is B, Gatorade or electrolyte fluids are going to be the main fluids that should be provided during nausea, vomiting, and diarrhea. Again, have a little bit of sugar, a little bit of salt that helps to prevent dehydration. Soda is going to be too sweet, and carbonation can also cause upset stomach. Coffee should be avoided during nausea and vomiting because it is going to be an acidic food that can worsen the stomach irritation. And then milkshakes should be avoided for 2 reasons. The sugar content in milkshakes is going to be too high as well. That can worsen nausea. And then milkshakes are typically going to be a higher fat drink. So we want to avoid high fat drinks that are going to be difficult to digest. So we want to avoid as much stomach irritation as possible. Question number 4, when should bland foods be introduced? Immediately after nausea and vomiting has subsided, 2 hours after vomiting has resolved, 3 days after vomiting has resolved, or 24 hours after vomiting has resolved. So the answer is D. So 24 hours after vomiting has resolved, bland foods can begin to be introduced. During the first 24 hours, you really just want to focus on liquids, clear liquids, and then 24 hours after there's been no vomiting, we can introduce bland foods such as the BRAT diet, so bananas, rice, applesauce toast, or some other foods that are easily tolerable, nice cooked vegetables such as carrots, oatmeal, plain noodles, scrambled eggs, chicken breast as well. And then question number 5, which foods should be avoided during illness? A, pizza, french fries, bacon, corn. B, mashed potatoes, broth, saltine crackers, popsicles. C, scrambled eggs, melon, and oatmeal. Or D, grilled chicken, plain pasta, and green beans. The answer is A. So pizza, french fries, bacon, and corn should be avoided during illness because of the higher fat content, higher fiber content of corn. These food items can cause additional irritation in the stomach. So during acute illness, we want to avoid these foods and wait at least 3 days after vomiting has subsided before adding in any of these regular food items into an individual's diet. However, all of the food items listed on B, C, and D, these are going to be our bland foods that are going to be introduced after 24 hours after illness has resolved. And that is the end of today's presentation on the BRAT diet. Thank you so much. Have a good day.